So how does PRP therapy work? In a PRP therapy treatment, we take a vial of blood. This is just like having a blood test. And we put that vial of blood in a machine called a centrifuge. The centrifuge spins it at such force that when the vial comes out of the centrifuge, all the different components of the blood are separated in order of weight. Now, the red blood cells and the inflammatory parts of the blood we don't want to use, so we discard those. And the tubes that I use actually trap them below a gel barrier. Above that, we have the plasma, the yellow liquid. At the bottom of the plasma, you will have the platelets because they would always sink to the bottom due to the weight. The system that I use allows me to actually remove the weak part of the plasma at the top. So we call this platelet poor plasma. And then I can concentrate it right down to only harvest the platelet rich plasma, the true platelet rich plasma, because all PRP is not the same. There are more videos on that if you'd like to scroll down and have a watch. We then harvest approximately 4 ml of super concentrated plasma, and then I choose to do single needle injections as my application method. The reason being, from everything that I've seen, when you microneedle or when you use mesotherapy guns, a lot of the plasma gets wasted. A lot of it dribbles out or sits on the surface of the scalp or gets caught in the hair. So I choose to do very slow and controlled subdermal injections to ensure that we're getting every drop of that super concentrated plasma right where we need it to be, 2 to 4 millimeters below the depth of the scalp, hitting the exact area where the hair bulbs and the base of the hair follicle resides. When you inject those platelets, they release growth factors, and the growth factors regenerate the hair follicle and grow new capillaries. So PRP is very effective at not only stabilizing hair loss, but also thinning hairs. Results are usually seen from 3 to 6 months onwards, and it could take more than a year, 18 months, or even 2 years for the results to plateau. At a point where we see that the hair loss is completely stable and it's not going to get any thicker and stronger, we then usually look at a maintenance plan. I usually suggest the first 3 to 6 treatments to be done a month apart. After that, we continue every 3 months until the results plateau. And then usually for most people, once every 6 months is an amazing maintenance plan going forwards.